Hey guys, welcome back to my channel. My name is Janet. If you're new here, please consider subscribing. I talk about all things health. On today's video, we're going to talk about questions that I received from you guys after the first video where I discussed sickle cell anemia. Let's get straight into it. All right, question number one. What causes jaundice in people living with sickle cell anemia? Very good question, guys. So in the previous video, we saw that a normal red blood cell takes about 90 to 120 days before it has to be broken down and removed from the system. But the sickle-shaped cells, they get destroyed much faster. It takes about 10 to 20 days. So normally the liver does the cleaning up of the blood once the cells are broken down. But because the sickle cells are being broken down so much faster, the liver cannot keep up. Therefore, it produces a yellowish pigment called the bilirubin. So the bilirubin accumulates in the blood so much that it causes the yellowish color in people with sickle cell anemia. And this is what we call jaundice. And for people with darker skin, you can easily see it in their eyes. The people with lighter skin, you will see the skin, even in general, looking yellow. Question number two. Should people with sickle cell anemia be put on iron supplements? So guys, sickle cell anemia is not an iron deficiency anemia. So you might see them on folic acid. Folic acid is used to stimulate the bone marrow to produce more red blood cells. But their red blood cell count doesn't go up from taking iron, so it is not recommended. Very good question. Question number three. Is it only Black people who get sickle cell disease? No, they are, however, the majority. Other regions include the Mediterranean region and the Middle East, some parts of Asia, like some parts of India, and Hispanics from Central and Southern America also get it. Question number four. What causes the pain in people with sickle cell disease or sickle cell anemia? So the sickle-shaped cells sometimes clump up and they stick to one another. They become stiff. They're not as mobile like the other round, nicely shaped red blood cells. So when they stick to each other, they cause what we call vaso-occlusion. They occlude the blood vessels, minor or major, specifically the vessels leading to the brain, to the lungs, to the liver, in the joints. And when that happens, it causes ischemia, meaning the blood cannot deliver oxygen to the cells in those particular organs or those joints. So that causes the pain, which is commonly referred to as crisis pain. Very good question, guys. What is the life expectancy of people with sickle cell? That's a good question. In America, it is under 50, but I will tell you that I have seen people as old as in their 70s with sickle cell anemia. I've seen people in their 60s, I've seen people in their 50s. Obviously, the medical, we've had a lot of medical progress and treatment options and therapies that are improving the life expectancy. In sub-Saharan Africa, however, I would say it varies. Previously, we are told that children don't get to see their 10th, 80 to 90% of children don't get to see their 10th birthday. So I would imagine the life expectancy is pretty low in sub-Saharan Africa. Why are people with sickle cell anemia prone to infections? So we saw in the previous video that one of the organs impacted by sickle cell disease, sickle cell anemia, is the spleen. The spleen functions to produce white blood cells, which helps protect us from illnesses. So when this is destroyed in patients or people with sickle cell anemia, it leaves this population vulnerable to infections. Last but not least, a few people asked, how can we protect our children? So first things first, you have to know their status. So they have to be tested. If they're tested and found to have sickle cell anemia, then there's a few things you can do to stay on top of the disease. Keep them vaccinated. Stay on top of all their vaccinations. Make sure they receive all their vaccinations. They may be put on medication, one of them being penicillin to prevent infection. This penicillin is going to be a daily medication that they will take until they're around 5 or so years of age. This protects them from frequently getting infections, because infection is a trigger to crisis pain. So penicillin or whatever antibiotic they put them on will protect them from getting infections and having to be hospitalized frequently. Another thing you can do is maintain high standards of hygiene, because that's also going to be an issue with getting infection. Another thing you can do is educate yourself. As a parent, educate yourself on sickle cell anemia, on sickle cell disease. And then once your child is of age where they can understand, educate them as well. Don't just hide it or make excuses. Let them know what is going on and that it's okay. So because they will be a partner, they will partner with you in managing this and putting this disease under control. And stay on top. If you see any illness, do not ignore it. If they need to be seen by a doctor, if they need to be in the hospital, let them be seen. Once again, guys, thank you so much for sending in your questions. I will see you guys in the next video. Bye-bye.